Good morning, everyone. Welcome to our session with our pelvic floor physiotherapist. Our pelvic floor physiotherapist is Liron Kvaterman, and she is practicing in two different locations. She has an undergraduate degree in biology from York University and went to Scotland for her master's in physiotherapy, which is so amazing. She had baby fever for as long as she could remember, and she always had an interest in all things pregnancy and postpartum. She used to just spend hours researching things just for personal interest. And then when she was in school, she learned that women's health was a whole specialization in physiotherapy. Wow, what a bonus, right? And ended up getting a placement in a maternity hospital. She loved it so much that she extended it into two placements. And from that experience, she knew that she wanted to be a pelvic health physiotherapist. So she came back to practice here in Canada, and she's taken all three levels of the pelvic health solution certification. And she's continuing to take numerous courses to strengthen her knowledge and clinical practice. And we're very excited to have her here. And she's just going to give us a very good overview of what pelvic health physiotherapy is, how it pertains to a T with pregnancy and postpartum, and even beyond, and how getting your pelvic floor worked on at the start of your pregnancy can set you up for an amazing birth and delivery and recovery postpartum, and also how having things taken care of when you're going through pregnancy can actually set you up for better life physio health. Set you up for better pelvic floor health in your when you're going through menopause and things like that. So later in life, starting early is a great idea. So we're gonna have a go at this, and we're gonna start with a very basic question. What is pelvic health physiotherapy?
Yes, it's a question that I get a lot. Now that I am a pelvic physio, I feel like not many people actually know about pelvic health physiotherapy. So essentially, it's a specialization within the field of physiotherapy that really focuses on the treatment and functional concerns that are related to, but not necessarily limited to, the core and the pelvic floor. And so some common conditions that pelvic health physios treat are pelvic pain, prolapse, incontinence, constipation, diastasis recti, which is the separation or the stretching of the abdominal muscles, painful intercourse, and basically everything involving pregnancy and the postpartum period.
Amazing. That seems like a lot. I know it's relatively new in terms of more people are starting to know about it. So I think this is really relevant information to right now, especially because the women who are getting pregnant these days are looking for all these natural alternatives to support themselves through pregnancy. So you mentioned all sorts of reasons why we go see the pelvic floor physiotherapist, but what is the actual pelvic floor?
That is a good question too. So the pelvic floor are basically a group of muscles that line the inside and the outside of the pelvis and sit at the bottom like a bowl. If you can imagine just a bowl of muscles at the bottom of your pelvis. They have 5 main functions, and in no particular order. One is sphincter function. So voluntary muscle movement in the front and the back. So when you're out and about and you feel the urge to pee, for example, you don't want to leak. So those muscles stay contracted and keep everything in. And then when you go to the washroom and you want to void, those muscles relax and allow you to empty. The second function is support. So they support all of the organs that sit on top of the pelvic floor, that being your uterus, bladder, rectum, right? Nothing should fall, everything stays up. The third thing is stability. So the same way the muscles in your shoulder stabilize the shoulder joint, same way the pelvic floor stabilizes the joints in your pelvis. The fourth function is sexual function, and the fifth is sump pump, which basically has to do with lymphatic drainage.
Okay.
So the pelvic floor serves us in more ways than one.
Amazing. And you also said that part of your work is working on the core as well, because you mentioned diastasis recti and a few things like that. So, what are the components of the core?
Yeah. So, as great as the pelvic floor muscles are, they don't work alone. Like they don't work in isolation. They work with this inner core that we call. So that includes a muscle in the back called multifidus. And then you have your transverse abdominis muscles, which are your deep tummy muscles that start at the pubic bone, go all the way up and wrap around. And then you have your diaphragm on top that helps with breathing. And everything kind of works in concert, if you will.
Okay. So, we got a lot of muscles that we got to take care of then.
Yes. And we really look at the whole picture because everything is so connected.
Okay. So speaking of looking at the whole picture, what would it be like for me to come in for a pelvic health physiotherapy assessment?
Right. So a pelvic health assessment really includes a very detailed history, an external exam, and just a regular, exam that you would expect from any physiotherapy assessment. A lot of education and a lot of tailored recommendations on exercise and just function in your body.
Okay.
And then a component of pelvic health physio that is a bit different from regular physio is an internal assessment, which would allow me to see what the muscles are actually doing. So I would assess muscle tone, the strength, the coordination. I can check for prolapse, things like that. And then for pregnancy and postpartum, for example, I would also, apart from all of that, I would also be able to do some perineal stretching that would start at around 36 weeks and get the tissues physically ready for delivery.
Oh, amazing. Okay. By internal exam, I just want to clarify without being too graphic. You are inserting a gloved hand into the vagina to check all the parts and the muscles, and you give the woman some instructions on what she should do, and that you're able to actually engage with the muscles and see what's going on inside there.
Yes, but a lot of people, I tried to give as much information as possible so that people are as informed as they can be going into it. It's definitely different from, I think, any gynecological exam that they may have experienced in the past, because it's not passive, and I would want the client to be an active participant and fully engaged in the process, because just as I would be giving feedback on what I'm feeling and what I'm finding, I want them to give me feedback. So if we're treating pain, I want to know what they're feeling. If we're working on strength, I want to know what they're feeling and whether they're able to build that awareness, right, of their muscles.
Yeah, well, I know for myself personally, I mean, I didn't discover pelvic floor physio until postpartum, which is one of the reasons why I really wanted to interview you, because I think it's so important, from everything I've learned, to do it during pregnancy if you can. And I found the internal exam very comfortable. I was like totally comfortable, and it was very interesting. Like, I learned so much, and felt like I was much better able to, from that point, engage all those muscles more effectively. And I understood more about how to do the Kegels and other exercises that I was given. So I think it's a very important aspect of it, as long as the woman feels comfortable.
Yeah, I definitely think that a lot of people are very disconnected from their pelvic floor, and it's not surprising. It's not external. We don't have the same sensation. People are not very aware of that muscle group until there's a problem. So
right. Okay. So, I mean, I know we sort of said this, but when should a pregnant person see a pelvic floor physiotherapist? Do they need to wait, or can they start right away?
Yeah, my recommendation is basically as soon as possible. So pregnancy looks very different for everyone. It affects people's bodies differently. And if you just want to make sure that you're doing everything in your power to prepare yourself both mentally and physically for baby, then go see a pelvic physio.
Hey, wonderful.
Yeah.
Sort of.
And
Oh, go ahead.
yeah, sorry to interrupt, but you most definitely don't need to see one like every week of your pregnancy. But a pelvic floor physio can give specific advice, specific exercises, stretches, education that is completely tailored to you, your body, and your goals in mind. So yeah, pregnancy can be accompanied with some aches and pains, so like pelvic girdle pain, and all of that can be treated with physiotherapy.
So you're saying we don't have to go through pain during pregnancy, because I find so many women just when we're going through pregnancy, I guess, because it's a very limited time in our lives and a limited amount of time. Although I know when you're pregnant, it feels like forever. But a lot of the time, we women, or people in general, chalk up pain to, oh, this is just temporary, oh, it should pass, or maybe, oh, this is what I'm supposed to feel during this time. And I mean, I know from personal experience, but also from treating patients, that no, we do not have to be in pain. Pregnancy, I mean, some women love being pregnant, other women, it's means to an end. But either way, we do not have to have aches and pains throughout pregnancy. So let's do all the things we can do to help ourselves stay like happy and pain free and enjoy pregnancy as much as possible, right?
Definitely. I mean,
Okay.
pregnancy can really be a stressful process. I mean, you're worried about yourself and your body and maybe baby and the delivery, and postpartum, you're expected to then recover yourself and take care of somebody new. And so it's a lot, and it could be very overwhelming. And so our experience of pain is different when we're pregnant as well. So I think that it's really important to be even informed of that, right? And that's, I mean, pain is not the only thing that you should go see a pelvic physio for, right? Even if you don't have pain, it's a fantastic idea to go see a pelvic therapist, just to prepare your body physically, and I mentioned mentally as well. So I personally also offer a session where the partner can come in, and we can discuss different labor positions and include the partner so that they know how to help you, when you're in labor, right? So they can be an active participant as well.
That's great.
And then we do that perineal stretching to actually prepare the tissues, and then we can talk about some postpartum kind of early rehab stuff that can be done as well.
Okay, so I know right now we're talking about pregnancy, and you just sort of touched on postpartum. So let's talk about postpartum. What happens after we give birth? If women were already seeing you, when should they venture back to get checked? And is it a waste of my time, or should I come? What if I just had my kid and I didn't know about pelvic floor physio, and I'm learning about it for the first time today? What should I do? When should I come see you?
Yes. So postpartum is usually when women find out about pelvic physio, because for one reason or another, they have some concern and they just don't know whether their body is functioning the way it should. And so again, after giving birth, after having such an incredible big change happen to the body, a lot of women are left with a lot of questions and concerns, right? So pelvic physiotherapists usually see women at that 6-week postpartum check, like the same way that they would go and have a follow-up with the OB. And so at that point, we can discuss any and all concerns that they may have. And I can reassess the pelvic floor, look at the cesarean scar, assess the tummy muscles and things like that. And a lot of women are concerned about their pelvic muscles kind of post-delivery, both with cesarean or vaginal, and they think that their muscles are loose and kind of lax and weak, and sometimes the leaking and the when you cough or you sneeze or laugh, things like that, are not necessarily attributed to laxity, as people might think, but actually a lot of the times it's quite the opposite. So what I mean by that is our body really tells a story of what's happening in our minds. Like, our body is very much a reflection of what's happening in our minds. And if we're stressed, that is completely reflected in what our body and our muscles are doing. So on a muscular level, we might, clench our jaw, hike our shoulders up, maybe suck our tummies in, or grip our glutes, right? And in the same way, we tend to clench our pelvic muscles. And so during pregnancy, as I mentioned, that can be very stressful. And then postpartum, you are recovering physically yourself and now have a new human to take care of. And so all of that can really be reflected in what your muscles are doing. And so a lot of the time when people after birth experience kind of pain and discomfort and leaking, it's a lot of the time not because of laxity, but because of increased tension in the pelvic muscles. And so in that case, I would teach my clients how to mindfully relax their muscles, bring awareness to what their muscles are doing, release any painful areas, and teach them how to really use their muscles in a way that would serve them better.
Amazing. And so I like here you're sort of touching on the emotional part reflected in the physical. So I'm glad that you also recognize that how much the emotions have an impact. Have you ever had any patients that you felt the emotional was way overriding the physical stuff? And although, of course, you can directly address the physical, but how do you deal with that when you feel like there's so much overlay of emotion on top of the physical aspects?
Yes. So I definitely don't want to overlook the emotional kind of experience that a woman goes through during pregnancy and postpartum. It is a very pivotal moment in a woman's life. And like I mentioned, I kind of touched on it earlier, that the experience of pain in our body really changes with our emotional state. So pain is really an emotional experience as well. And a lot of times, birth does not necessarily go according to plan. And sometimes it could be upsetting and even traumatizing. And so my job as a physiotherapist is not only to assess the physical well-being, but also take into account your mental health as well, and to provide the appropriate resources and support. And so actually, I work at the womb that has a phenomenal team of practitioners, including naturopathic doctors and osteopaths and chiropractors and social workers. And so we really kind of take this holistic approach to treating everyone that comes through the door. So it's really multifaceted, and we take everything into account.
Wonderful. That's great. So that's the womb in Vaughan. And also you practice at another location as well. People can find you somewhere in Ajax. Tell us about that clinic.
That is in Ajax. It's called Women's Health Physiotherapy Center in Ajax. And they also have a great team of practitioners and a holistic kind of, they also take a holistic approach to treatment. So they also have counselors and osteopaths, registered massage therapists. So
that's wonderful. So everywhere, each place you work, you're in some kind of multidisciplinary situation. Me too. I think that is really the future of healthcare. We want to make sure that our patients not only get our expertise, but also have access to other people that we know and trust. And that's wonderful that you're in both environments like that. So your full name is Liron Kvaterman,
Yes.
and you are a pelvic health physiotherapist. And how can people find you if we're in there anywhere in and around the vicinity of Vaughan or in and around the vicinity of Ajax, and they would like to benefit from your expertise in person? How can we find you?
Yes. So in Vaughan, I work at the Womb Vaughan, which is around Highway 7 and Center. And if there are any questions, you can book with me online. And if you have any questions or want to see me in Vaughan, you can go to thewombvaughan.ca. And in Ajax, it's women's health physiotherapy.ca. Yeah, and if you want to email me directly, my email is lironk, just the letter k.pt@gmail.com.
Wonderful, great. And I know you've got a few bonus gifts for our viewers. So when they go through, some of the gifts come automatically when they registered, and I think you have an extra special gift that's going in our bonus tier level. So everyone can look out for those wonderful gifts from you. Yeah, thank you so much for giving us your time and energy. I feel like we got a very good overview of what pelvic health physiotherapy is. Personally, I did use pelvic health physiotherapy when my second child was 18 months, and it was the best. It was the best. I had that sort of thought, even as a chiropractor, that I was going to be left peeing my pants a little bit every time I laughed or sneezed. I was going to just have to grin and bear it through intercourse, that it was going to be a little bit painful until it wasn't. And even I found even inserting tampons when I had my period was also painful. And I thought, oh, well, that's just what happens after giving birth to a couple of kids. And a friend of mine told me to go see a pelvic health physiotherapist. And honestly, 100% of what I just described went away after like 4 visits. I found it so informative, and I've been a huge champion of pelvic floor physiotherapy ever since. So I really thank you for your time. I think what you do is amazing. And yeah, have a wonderful day.
Thank you. Thank you so much for having me. I just want to touch on a few things that you just said. One, you don't have to live in discomfort, and leaking when you sneeze or cough should not be your new normal. Doesn't matter what age. Like postmenopausal too. And 2 is that it's never too late. So you said you went to see a pelvic physio after your second. It's never too late. Like, all the symptoms are treatable. Again, it's functional, right? And so there's really, anytime you actually seek out a pelvic physio is the right time.
I like that. That's a great way to end this. Have a wonderful day, Liron, and thanks for joining us. Okay.
Thank you.